Pharmacists have been counting their supply of tamoxifen closely ever since Canadian pharmacies started running out in August, sending breast cancer patients scrambling.
I just picked up the last 10 pills that they had in at my pharmacy, and the pharmacist is wonderful where I deal with. She called numerous pharmacies across PEI to see if they could get any, and they couldn't.
Monique Doucette had a double mastectomy and chemotherapy. To avoid recurrence, she's been taking tamoxifen daily for the past 7 years. Like thousands of other patients, she's worried about running out.
Will this impact me down the road? Will this be the thing that causes me to have a reoccurrence?
More than half of breast cancers are hormonal. Cancer cells use receptors to feed on estrogen and grow. Tamoxifen blocks the receptors, starving the cancer. It's also used to prevent cancer from returning.
There's a large number of patients who are quite worried.
This oncologist says tamoxifen can continue to be effective in patients even months after they stop taking it, so they shouldn't worry for now.
We would get more worried if that shortage, or at least a lack of access, would occur over multiple months, 2 or 3 months, would be when I would start to get a little bit more worried. Anything measured in weeks is probably within the spectrum of something that we don't believe will have a dramatic impact on cancer outcomes.
The biggest supplier of tamoxifen in Canada is Apotex. It blames the shortage on what it calls a change in manufacturing and drug formulation. There's also been an unexpected spike in demand, which has been a drain on the other two makers, Teva and AstraZeneca. There used to be several other manufacturers, then market forces started driving the price down.
Consequently, they just stopped making it altogether. Then we end up in a vulnerable situation where there's only 1 or 2 manufacturers, and either they run into a problem within the factory itself, or they run into a problem obtaining the normal raw materials, and there is no replacement.
AstraZeneca expects its tamoxifen shortage to be over next week, with the other 2 drug companies following suit in the next month or 2. But just like other critical drugs in Canada, shortages have been constant over the past decade. And health policy experts like Dr. Duffin warn it's hard to talk about national pharmacare without a plan to address Canada's drug supply. Vic Adopia, CBC News, Toronto.